Immediately, all the way to the right is Huang Yanzhong and Huang. He is a senior fellow for global health at the Council of Foreign Relations, where he directs the Global Health Governance Roundtable series. He's also professor and director of Global Health Studies. At Seton University's School of Diplomacy and International Relations, where he developed the first academic concentration among U.S. professional schools of international affairs that explicitly addresses the security and foreign policy aspects of health issues. He is the founding editor of Global Health Governance, the scholarly journal for the new health security paradigm. His books include Governing Health in Contemporary China, Routledge 2013, and Toxic Politics, China's Environmental Health Crisis and the Challenge to the State, forthcoming from Cambridge. Right next to Yanzhong is Wang Yan, Wan Yan. Yang, sorry. I have the Chinese written, yeah? Is an assistant professor of epidemiology at Columbia University's Mailman School of Public Health, trained as an environmental engineer and infectious disease modeler, interested in understanding how infectious diseases spread through the population, as well as methods to model and predict these epidemics. She's also developing forecast systems to predict outbreaks of infectious diseases. In addition, she studies how environmental factors influence the transmission of influenza, its seasonality, and the underlying mechanisms. Right next to me is Nick Bartlett, is an assistant professor at Barnard College, Columbia University's Department of Asian and Middle Eastern Cultures. He worked in public health in China before training as a medical anthropologist. In addition to current research exploring the adoption of psychodynamic traditions in mental health interventions in China, he is author of the forthcoming Recovering Histories, Life and Labor After Herring in the Reform Era China. I also want to thank Nick for the idea of organizing this panel and for organizing it, all of the efforts. So we'll give each panelist about 15 minutes or so. We'll start from Yanzhong and all the way this way, and then I may interject with some questions later on, and then we'll open up to the floor. How's that?
You want to start from me?
Yeah.
Okay. Oh,
yes. I'm sorry. Blanking.
I thought it was a plan B.
Yeah. Hi, everyone. Is it okay? Yeah. So thanks for coming and thanks for having me. Since I start first, okay. I'm going to give you just an overview of what's been happening so far. So we know that retrospectively, the first case of the new coronavirus was recorded in December 8th last year. But over the last 2 months or so, it have evolved so fast. Right now, as of yesterday, we have 78,000 confirmed cases globally, and the majority of these cases occur in China. So the number probably increased a lot by now, since we are counting cases by the minute right now. And aside from China, it spread to around 29 countries. In terms of case fatality risk, tally over all the cases we know so far, it's about 3%. So it's less severe compared to other coronavirus like the SARS epidemic in 2002 to 2013, which caused about deaths in 10% of the infected cases. Or the MERS-CoV, the Middle East coronavirus, which is even at a higher rate, about a third of infected die from the disease. So that's sort of a good news in terms of this new coronavirus. However, we are also seeing some quite concerning new development. Although the cases in China have been declining since early February, so this month it has been declining for about 3 weeks. We are seeing some rebounds in places outside of China, outside of Wuhan or Hubei, which is the origin of the coronavirus. The city of the origin is Wuhan, and then the province that encompasses Wuhan is called Hubei. And since after the end of the Chinese New Year holiday, people started to travel, return to work. We're seeing some rebound in terms of cases outside Hubei province, which right now is under still very stringent control. We are also seeing increase in case outside China, including South Korea. We have clusters, huge clusters developing in the last couple of days. We are also seeing huge increase in Italy and Iran. So we're going to see what will happen afterwards. Now, next I'm going to give you some basic idea and principle when we think about a new epidemic and a new viral infection. So key factors when we think about an outbreak and normal infection, we first want to know like what is the route of transmission, how does the disease transmit. And for the new coronavirus, this is mainly through the respiratory, it's a respiratory infection, so it's through droplet when people cough, when they sneeze, the droplets can disseminate, and then as a result, people surrounding it get infected. It could also through the nuclei, which is when the virus. The droplet sort of evaporate and you remain. As a result, the size of the droplet shrink dramatically, and as a result it can suspend for a really long time. And the size is important too because it determines how far it can penetrate through your respiratory tract. The smaller the droplet, the further it can go, and likely more severe the disease will become. Now, compared to other viruses, which could transmit it through direct contact with body fluid like Ebola, respiratory infections are notoriously difficult to contain because it's in the air and everyone has to breathe. And aside from that, when we think we need to know how infectious this novel virus is, and we think about infectiousness, there are 3 key factors. One is that how many number of people we come into contact in daily basis. So that's the number of contact. And then there's also the probability of infections per contact. So the more infectious, the probability after exposure will be higher. And there's also the infectious period, how long can a person remain infectious and spreading the virus. So if we combine these 3 factors, we can calculate the infectiousness and use a variable called basic reproductive number, or AMEC. You might heard people talk about that variable. So essentially it tells you on average how many cases one infection can infect if the entire population is susceptible, and this is the case when we have a novel infection. Now for the for this coronavirus, through modeling exercise, we know this is between 1.5 to 4, so there's a little bit of uncertainty. But the mean is slightly above 2. So what does that mean? That means like if I'm patient 0 and I walk into this room, the entire room is susceptible, then on average I'm going to infect 2 people, and those 2 are going to go on, each infect another 2. Now we have 4 people. Those 4 are going to go on, each infect another 2. Now we have A, and so on and so forth. So in the beginning of the epidemic, it would grow exponentially on the basis of the basic reproductive number. And how does it compare to other infections? For pandemic flu, it's at similar level 2009 flu pandemic estimate for that number is about 1.5. So the current coronavirus actually is slightly more infectious compared to the 2009 pandemic. Now, compared to other coronavirus, the SARS coronavirus has an R0 around 2 to 3, so they are similar. Now, other factors other than the basic reproductive number is along the course of the epidemic, the population susceptibility could change over time. Right now, almost the entire population is susceptible. Now, if we have a huge outbreak or a pandemic, that's going to go down. Alternatively, if we have a vaccine, that would be a very effective way in terms of reduce the population's susceptibility and build up the population immunity or the concept of herd immunity. And that's one of the key reasons we keep asking people to get vaccinated for seasonal flu and for vaccine preventable disease like measles that just like increase your herd immunity and cut down the chain of transmission. Now, related to the first three factors, it also tells you how we can contain the epidemic in terms of number of contact. We would advise people to do like social distancing. You stay at home, so you reduce your number of contacts you have on a daily basis. Now, in terms of the probability of infection per contact, so the second factor, we could PPE, facial mask, so that would reduce the number of virus that could potentially penetrate into your respiratory tract. And this is particularly important in a healthcare setting where the first line fighters get into contact with patients all the time. But unfortunately, hospitals infection do happen a lot in this epidemic. In total, by now, there's over 1,700 confirmed cases among the healthcare physicians. So, and a few of them actually die from the disease, which is very sad. Now, in terms of the theory of infectiousness or infectious theory, we could do contact tracing. So we'll put people in contact with people with confirmed cases on watch. So as soon as they develop the disease, we could isolate them in a very timely manner and put them on treatment to reduce further transmission. Now, in terms other than the infectiousness, another key factor is case fatality risk. I mentioned right now among confirmed cases, this is about 3%, but research shows that there's massive underreporting, especially in the very beginning of the epidemic. So if we factor in this underreporting, which may be between 5-fold to 10-fold, then you can divide the 3% by 5 or 10, so that will further reduce the case fatality risk, which is another good news. But still lots of uncertainty because we have a huge number of people getting infected, which we haven't had the end compensatory result as of yet. So this number could increase if those infected cases eventually die from the disease. So there's lots of unknown. Now, in terms of the key factors that contribute to this outbreak and the discovery and reporting of the epidemic, there are some issues. One is we know the symptoms has a huge spectrum. Some of about 80% actually only have mild cases. And for respiratory infection, the symptoms are very similar. You cough, you sneeze, you have fever. You really can't tell if that person have the flu or just a common cold or a new infection. And it's winter season. It's in the middle of a very severe flu season in Wuhan at the time. So at the beginning, you really don't know whether it's a new disease or not. So you have to factor that in. And also that it also coincides with the Chinese New Year celebration, so there might be massive gathering that increase the transmission. There's also the massive travel across China. So to give you an idea how massive that travel is, last year China over the 40 days New Year travel period, which is 15 days before the Chinese New Year, during which college students or workers that will return to their hometown, and then 25 days afterwards, they will reverse the direction of travel and return to the cities they work or study. Now, last year, China recorded 3 billion trips during that 40-day period. So think about that. So, and Wuhan is right in the middle of China, which is a major transportation hub. And some reports saying that before the 23rd shutdown of the entire city, the 5 million, 15 million, 5 million? It's 5 million. Yeah, 5 million people got out of the city, and that's similar to our previous level. Not that they like free out of the city, and about 1 million they are students, college students, because Wuhan is a major college town, and we know students travel far, and so that's part of the reason it quickly get out of hand and spread across China. Within like 2 weeks, it almost reached every city, every province in China. It also quickly get out of to other countries. And so that's one of the major challenges. So in order to control the further spread, China quickly shut out Wuhan 2 days before the Chinese New Year. But we have also to take into account when you have a huge number of infections, even though with very draconian control measures right now, the RNOC or RE, the number I just mentioned, has gone down quite a lot. Right now is probably less than 1. That meaning the epidemic is going down. But when you have a huge number of people who are infectious, it's going to take some time for the new number of cases to actually go down to 0. So we have to take that into account. And also with the resume of travels after the Chinese New Year, because people have to go back to work, their livelihood depend on it. We expect there might be some rebounds in terms of infection in cities outside of Wuhan. China have been taking some measures to counter at least this new event. And I mentioned outside of China, there's increased cases as well. So we are at a very critical window of control right now. So I'll just turn over to.
Thank you.
Well, thank you. I'm glad to be back, and want to mention that more than 10 years ago, I was an adjunct faculty here teaching Chinese public policy at the SIPA. So glad to be back. Actually, I didn't know that I have 15 minutes. They feel like you might feel bored when I keep talking for 15 minutes. And also, I'm not sure what you are interested in hearing. Because I expect that you probably want to hear this question that whether we are in a pandemic or not, or we are entering a pandemic. And also maybe you would like to hear that the effectiveness of government response, and then maybe also the potential impacts on the global economy. So if you will, I will try. So I think just to follow up with Professor Wang's remarks, on Friday I had the conversation with a leading global health personality. We talked about this potential of a pandemic, and she was very pessimistic. He was basically saying, we are actually entering a pandemic. It is irreversible. But I don't want to scare you. I think maybe that reflects my wishful thinking. I think we are not yet in the pandemic. I think this morning I printed out these 2 copies. One is this fatalities and cases, the SARS outbreak in 2002, 2003, and then research associate sent me this updated information on number of cases and the fatalities in China and worldwide. I did the comparison. I found this, I think pretty much we are still like, in terms of the cases and in terms of also how it is spread worldwide, I think we are still in an epidemic stage. I'm not talking about China. I'm talking about other countries beyond China. SARS affected around 32 countries worldwide, and as of yesterday, I think we had also about 32, 33 countries being affected. That is, they have reported cases, right? And if by definition, pandemic is defined in terms of large-scale, sustainable transmission, right? So far, we might have seen like those sustainable transmission in countries like South Korea, maybe Italy, maybe Iran. But most of the countries, I would say, their cases remain, relatively speaking, small. And many of those are actually imported cases. In this country, for example, we have 34, 33 cases, according to CDC. And if we trust the CDC data, almost all of them are imported cases. So that means they have not developed sustainable community transmission. That is my opinion. But we may be, as the Huang CDC official said, on the verge of a pandemic. Okay. So that is my hunch. And speaking of pandemic, just to finish the piece that is to be published at the CFR website, basically exploring its impact on world economy. I think the impact is probably more complicated than we thought, even though overall you could say the impact would be very negative, the business closures, right? Unemployment, especially if the pandemic lasts more than 1 year, it may cause a global recession. And also, if you take into account this factor that now the situation today is different from that 17 years ago, right? At that time, China was not considered chief engine of global economic growth, right? And today, it's already the world's second largest economy, right? Its share in the global economy has expanded from 5% 17 years ago, right, to now 13%. Right? And a world economy is so dependent on China for their products, for their consumers, that would be also highly subjected to all those exogenous shocks, like a disease outbreak from China. But as I say, that impact probably will be more complicated than we thought. It depends on the nature of the virus and the trajectory, how it evolves. Other things being equal, I hate to use that example of the Black Death, right? When you have basically a disease only kill, right, the weak, right, the elderly, right, and you have a large number of healthy population actually exploring all those unexploited resources. You're going to see the GDP per capita going up, right? And also we need to make a distinction between the impact during the pandemic and the impact in the immediate aftermath of the pandemic. Again, if we look at the history, right, the 1918 Spanish flu, actually, in the immediate aftermath of the pandemic, right, we actually seeing the income per capita grow rapidly. And actually those states that hit particularly hard in terms of high mortality, and actually saw the fastest growth. So that might, if they have something to do with the economic growth after the end of the war, right? The war itself cannot fully explain why, right, that the growth is fastest, right, in states with the highest mortality rate. So the impact, again, is more complicated than we thought, maybe more complicated. So this is the first question about the pandemic. Second is about the government response. I'm talking here about focusing on Chinese government's response. Okay, when in the initial stage of the outbreak, actually before that, right, the consensus among the public health experts, China watchers, was that SARS is a watershed. China has drawn the lessons from SARS. They have significantly improved their public health capacity, right? And something like SARS is never going to happen again. Right? That turned out to be the case. Right? I think, in a way, the 2009 right, the flu pandemic, right? And then the 2013 H7N9, the bird flu outbreak also give us this false illusion, that the government could handle, a major disease outbreak very well. And that turned out not to be the case. Right? In fact, in the initial stage of the outbreak, I was asked to write something about the coronavirus. I was not even sure, that is worth writing about, because the Wuhan Health Commission basically announced January 12th, I think. So there have been no infections since January 4th. Right? So this is a 1 week, right? You expect that it was incubation period, right? So I said, well, that means the outbreak was over. Hallelujah. Right? But then it was this January 18th, right? There's and then the announcement of Dr. Zhong Nanshan said there was indeed human-to-human transmission. Right? And I found this pattern of this strong parallel between the SARS outbreak and the coronavirus outbreak in terms of government response. That is how I wrote this piece based on the very limited information I had. This piece on New York Times, I said, we have indeed seen very strong parallel between these two outbreaks in terms of the government response. There was now, of course, a smoking gun evidence point to this inaction, right? Cover up, if you will, right? And then this drastic government containment measures, you might call it overreaction, right? But certainly, it depends on how you view that response. But from a political scientist perspective, I'm trained as a political scientist. You've seen that this these two polities being at work. Right? In the initial stage of outbreak, I would call it more like a bug passing polity. In hindsight, each policy actor, seems to be saying it's not my responsibility, right? From the top leaders, right, to the local health officials, nobody seems to be taking responsibility for that, right? CDC officials say, I did the reporting, right? The Wuhan government officials say, I just did what I have to do, right? Because I have to wait until the up level to tell me, right, what to do, right? And then President Xi said, well, he issued the directives, right, on January 7th. Right? So that was, like, in my opinion, that this is a buck passing polity. Everybody, each actor seems to be shirking its responsibilities. Right? But it was precisely by those different moves, right, those actions, right, that created the perfect storm, right, leading to that probably this unprecedented outbreak, right, in PRC history, right? I'm not going to again talk in detail, right, how the government actually responded during the first stage of the outbreak. Now we have all this information there, right? Basically, you could connect all the dots, right, and have a better picture, a more complete picture of what was going on there. Then, after January 20th, especially after January 23rd, what we saw this what I could call this working of the bandwagon polity. Right? So it's from buck passing to bandwagon. Right? That is when President Xi, right, made this as a top priority. Right? That all the policy actors jumped onto the anti-coronavirus bandwagon. Right? You have seen, right, those draconian measures being in place. Right? The entire city of Wuhan was locked down. Right? Actually, the entire country was locked down. Right? The villages being sealed off. Right? The city is being locked down. The factories being closed. Right? Schools being closed. Right? So this is also all these containment measures, right, in order to stem the spread of the virus. Again, it's not just unprecedented in PRC history. I would say it's unprecedented in the history of modern public health. And interestingly, when you look at those policy instruments, right, it's containment, right, quarantine, isolation, social distancing measures. They're really no different from those like in the medieval era, right? Where we have cordon sanitaires, right? Quarantine. Quarantine is from Italian. It means 40 days. Right? Lazaretto. Right? All those, the policy instruments, despite the advancement of the modern medical science, biotechnology, still, right, we are so heavily relied upon those classic tools, right, in containing the spread of the virus. And how effective are they? Right? Again, we look at the data. Right? It is my humble opinion that the situation in provinces other than Hubei seems to be stabilizing, although there might be fluctuations in terms of the number of cases, but I think the situation is improving. Even in Hubei, it's not as bad as it was more than 1 month ago. Right? So their situation is also improving. So that seems to suggest that those draconian containment measures seems to be working. Right? Although I'm not the epidemiologist. Professor Huang probably has a better answer to that question. I think it's very hard to establish a causal link here. That is precisely because of this containment measures that leads to the drop of the confirmed cases. In fact, there was a study on the SARS cases that found that the R naught, that's a reproduction number of the virus, actually already was below 1, right? Because when it was below 1, the virus essentially ceased to have sustainable transmission, right? So it was already below 1 before the government kicked off those containment measures, right? So, while the containment measures during the SARS outbreak might stamp or prevent the spread of the virus in unaffected regions, according to that research, it has not necessarily led to the factual containment of the virus. And also, this current measures was pursued to a much larger scale, right? More intensive degree. Right? So we have also to take into account its unintended, undesirable consequences, right? The impact on the economy, right? The business failures, right? The impact on the global supply chain. The Indian government was already very concerned that past April, they might have difficulties of formulating drugs, because the 70% of their APIs, the active pharmaceutical ingredients, actually from China. And last week, yes, I was in Chicago, giving a talk. And after that, we had a dinner with one of them happened to be a board member of the university. He talked about, and now their concern was that his daughter, they might they're very concerned that her prom dress would not arrive in time for the pride. So because the factory is in China. So this is all very realistic, serious concerns. And there are also the secondary effects, right? When you have attached this top priority, right, to the corona disease virus control and prevention, you actually, that naturally leads to the neglect of other conventional diseases, right? People who need dialysis, right? People who need surgeries, people who are suffering non-communicable diseases that needs care. Right? This is actually causing big problems now. I heard that in some, there's in Wuhan, there was this hospital evacuated the terminal cancer patients, in order, to have enough beds for the coronavirus patients. And here you would have this huge debate on whose lives was more, right? Coronavirus patients or cancer patients, right? In China.
Yanzhong, 2 minutes.
1 minute, I'm going to stop. So they have, each year there are several million cancer cases. China, they have 800,000 HIV patients. Right? They need to have access to life-saving medicine. That was disrupted, right? Because, again, of those lockdown, right? The cities, right? The traffic, blocked, right? So these are also secondary effects also have to take into account when we do the evaluation on the impact of the containment measures. So with that, I'll stop there. Thank you.
Thank you. All right, well, I'm going to start by saying that I, unlike my esteemed panelists, am not a coronavirus expert. Hopefully, I can come at these questions in a way that sort of segues to our discussion with you. I'm trained as an anthropologist, but before that, did work in China in public health. And actually, I was there in 2002 to 3, and SARS, which has already been brought up, was a very big part of the HIV work that I was a part of then. And my own sort of simplistic thinking at the time was after 2003, the work really opened up. And what was possible for the next several years, including not only what was possible in terms of what was being allowed by the government, but being organized through the government, including CDCs, rapidly expanded. I have a colleague, Catherine Mason, who wrote this book, Infectious Change, Reinventing Chinese Public Health After an Epidemic. And she's got a more interesting, nuanced read than my own. And she talks about, it's interesting, SARS emerges at the moment that the anti-epidemic stations, the Fangizhan, are being replaced by the CDC. And this is a modernization. There's huge amounts of money because of SARS that go into it. There's lots of biomedical technology that shifts. And she has this sort of 10 years on, has this interesting take on both what is gained by that shift, but also what is lost, including a certain Maoist commitment to who is being served. And I think that that's a point that I think is very important in thinking about what at times is presented as a technocratic exercise, but often is experienced as choosing different communities, different populations. Is the population of intervention the primary one that one is caring about? And I think that you really see this in various patient narratives that are emerging about people who feel abandoned and different feelings. So I think this would be true anywhere, but especially in China, there's a certain legacy of Maoist ways of thinking about health that I think are relevant in considering. A second thing I wanted to talk about is the question of state power. And I think that clearly, and I'm coming at this less from a public health, what do we do now, and more maybe from in a few years, what types of questions So the question of what type of state power is emerging in this moment. In the news, you hear the evocation of Maoist power, Maoist-style social control. And I'm interested in this. And if that is an accurate assessment of how people are being mobilized. There's the grid management system and this Wang who are supposedly being organized through a 社区 that's supposed to be functioning as a danwei. And I think this is really interesting because a certain legacy of a mode of organizing and delivering care to local locations is being reinvented in interesting ways. And I think the question of who is participating with what imaginations and what relationship to the party and how hundreds of thousands of people are being mobilized to do this care work and to stop people from moving. I think it's very interesting. Is this Maoist and in what ways? A second, I also think it articulates interestingly with particular understandings of care. And the notion, there's been an article by Zhu Jianfeng and some colleagues from last year that is about the notion of guan, which both means to manage and to care. And there's a certain tracing of the genealogy of that term and how people experience care and how, for example, chronic mental health in the community is imagined and delivered. And I think, again, it's interesting to think about both how the epidemic is an extension of certain modes of caring and thinking about care, but also potentially changing them in pretty radical ways. Another thought that we can talk about more if you're interested, the question of technology, I think, is, and again, the question of in whose interest, who is being helped by the way that technology is being mobilized during this epidemic. There's the social credit system, which is threatening to punish people, right? For if you don't take responsibility for yourself, we will, you'll be put on this list and things will be bad. There's also the lots of, as I understand it, private sector apps being developed that promise all sorts of, like a friend of a friend works for a cab, like cab apps that allows you to track, was I in the cab with somebody who that day had the virus, with incredible accuracy, right? It just came out 3 weeks ago. And so I think that the capability, and also obviously cell phone data and the question of where you've been and how this is being used, it can be, who has access to whose data and to whose benefit, I think, is being articulated. These questions are coming up in really complicated ways as the technology becomes so sophisticated, and seeing, for example, cases in real time in your neighborhood to an incredibly granular level. I think that and I also, I guess, this question of tracking, because I work with heroin users. I was part of, or I was not, they were part of an early system of tracking, which was this 动态管控机制, like for 吸毒者. So it was mobilized in 2006, and it's specifically tracking drug users linked to their ID. Whenever they check into a hotel anywhere in the country, the local police know that they're there. And so there's this whole system that was built out in a quite sophisticated and early way to track drug users. And I think, I don't have time to talk about it, but it's complicated what that does and how people's behaviors change and how their relationship to the state changes as they're being tracked in more nuanced and deeper ways. Another thing I wanted to mention briefly was the issue of racism internationally, and kind of the question, there's been thinking about SARS and the legacy of what we learned from SARS. I think that there's been some, well, actually, first just to set the stage, I think the Wall Street Journal article is probably one of the more notorious. China is the real sick man of Asia was the headline from a couple of weeks ago. But also, I'll just read 2 sentences because it's good. Its financial markets may be even more dangerous than its wildlife markets. That's the subheadline. And then below that, the coronavirus is a metaphor for 2 political ideals that are incompatible with the realities of the modern world: China's Communist Party and isolationism. Whoa. So anyway, we can unpack some of that maybe a bit later. I guess what I wanted to focus on was actually the part about the wildlife markets and how this gets mobilized. And Meizhan is an anthropologist who wrote a fantastic article a few years ago thinking about civil cats, SARS, and unruly bodies. And basically she's arguing, I'll just quote her directly, we see the recurrence of a familiar narrative strategy that visceralizes the traditional and the uncanny as the origin of a culturally specific disease that, if not contained, threatens to destroy the global. I think this idea of the visceral as a particular form of racism is really interesting and very much present today with, again, the same questions about markets and what wild animals and potentially the people's wild desires who consume them and how they need to be disciplined, and markets need to be, these wildlife markets need to be disciplined in particular ways. I have a colleague who, actually his book is just about to come out, and he's looked at specifically this question. It's called, it's Lyle Fernley, and it's Virulent Zones, Animal Disease and the Global Health at China's Pandemic Epicenter. And he's very interested in the question of, like, what precisely does wild mean? Is this a meaningful category in relationship to non-wild, farmed? And then if it's farmed, well, anyway, it turns out that this is an incredibly complicated problem that is not easily solved, and that bans are not necessarily. So I think that is an interesting one part of the response, that this question about how the virus itself is always both a reality, but also an epidemic of signification of language and of that creates as well as it reflects, or as well as it supposedly reveals. Finally, I just wanted to finish with looking forward to how this epidemic is affecting people. I mean, obviously, there are the people who are infected with the virus itself, but there are also, hundreds of millions of people whose routines are pretty radically disrupted. And then definitely millions who are spending a lot of time by themselves with their family, in these spaces that, and I think that this leads to a lot of really interesting anthropological questions. SARS was known, right, one of the narratives was it helped Alibaba emerge. Has anybody heard this? Like this is the moment when Alibaba actually was helped because of the B2B software people didn't want to go to China, so they used the platform. And then Taobao was launched that summer, and apparently several employees had contracted SARS. So they're really battling SARS, but also emerged victorious. And there's Taobao, and there's world dominance. And so the question becomes, well, what is this iteration of those potential changes? And I think that the one intriguing thing that I've seen, because I'm working in mental health, is people are having to make the decision who are therapists, for example, but one of many instances. I've never seen a patient virtually before. Do I do it? Or am I just not going to see my patients for 2 months at a time? And my mother-in-law supervises through Skype or through WeChat, through any service, is supervising a therapist there. And she's going through this question of, well, which of my patients are accepting it and how do I feel about it? And you have this whole, and then afterwards, if you do start working with patients virtually, then does that change the way that you work? So I think that potentially profound ways in which work culture could shift because of this. And working virtually could be something that it's like, well, if that worked reasonably well, why don't we keep doing it? So I think a potentially interesting consequence. So I'll stop there. Thanks.
Thank you. Thank you all. We really covered a very wide range of areas. And let me just add one, and particularly for someone who studies cities and who studies how policy responses to urban issues. And I really find that some of the topics very, very pertinent. And I think China also represents very much a place in the country that is in transition. I mean, so in environmental transition literature, and in this case, maybe we can say it's public health transition, that is, it represents and embodies a set of issues and challenges that are associated with developed countries and cities or industrialized. On the other hand, embodies a set of issues and challenges that are very much still traditional and less developed societies. And so in this case, I think, Nick, when you're talking about technology, right? So, China has leapfrogged in a way of really show that. But on the other hand, if we think of settlement patterns, the density of human contact, the density of living conditions, the levels of infrastructure, and I think the cruise ship docked at sea, in Japan really illustrates the importance of infrastructure and the kind of infrastructure that is necessarily needed in this kind of situation. And then the quality and resilience of healthcare. So I think there has been now more concern that when the virus spreads to countries that are similar to China on the less developed side, it will be really more of a challenge than it spread to Italy or France or England, right? Because if we look at settlement patterns, human conditions, infrastructure, quality, and healthcare resilience. And so maybe we can think of a concept is really almost like public health resilience. In a way, in some ways, it's actually contradictory to sometimes we call environmental sustainability. We want to have people live close by. We want to house more people on less land. We want to use public transportation, but all of which will create a situation where viruses travel more easily, be it a communal cluster or what we call transit cluster, right? And either way. So I think we're, the Chinese case where we are today really represents that kind of challenge. And it's a very difficult question. So maybe I can ask the first question and we'll open up is that on the one hand, as a student, a scholar of these issues, what do you see as things we really should be looking for, right, in this next few weeks or months in terms of our responses? But second, as a regular person, I mean, should I wear a mask? Should I not travel anywhere? Should I be concerned about, I think what's this sort of life goes on in some ways, despite all of the constraints. And what do you see as a sensible approach to thinking about that?
You want me to do that first?
Anybody.
Okay. All right. Okay, well, thank you, Weiping. I think you have raised some very, very fascinating questions, which I like, because my book actually addressed this issue on environmental health governance in China. So just for shamelessly promoting self-promotion purpose, that if you're interested, you're welcome to pre-order that book on the Cambridge University Press website. I think in the coming weeks or days, I think they'll probably want to look at the three developments, keeping a close eye on that. One is actually the trajectory of the spread of the virus, how many more countries are going to be affected, and whether they're going to see all those clusters, cases we're going to see in Korea, whether in the country like the United States, we see this sustainable community transmission. So this is what the potentially when leads to a pandemic. Right? And secondly, we want to look at how government respond to the spread of the virus. Right? We have already seen those very chaotic, uncoordinated international response. I was very upset, to be honest, that WHO is not taking a leadership role in coordinating international response. And so, essentially, you have seen all the countries responding to the outbreak in sort of this panic-driven way, sealing border, then sealing borders, canceling flights, and issuing public emergencies, and in some countries like obviously it's a violation of the international health regulations, Article 43. Basically the approach becomes so invasive, intrusive. Right? We saw that in Russia, for example. Right? Chinese people already being profiled, targeted. I think it's crazy. Well, crazy is not very scholarly term. And so that is second and third in the issues like the individual level response. But again, whether it's to wear a mask or not, that is a question. Right? On my way to the city today, I saw only 2 people wearing masks, and apparently 2 of them are like Asians, not Chinese. So the masks are to protect you, right, from catching the virus if it has an effect. But in the meantime, they are also symbol of fear and panic. Right? And if you're going to see probably only like 1/4 of the population wearing masks, I think this is going to be very, very bad for the society and for the economy.
So things I have in mind, I just want to first say that I disagree quite fundamentally with my fellow panelists in terms of China's response. I think it's been very impressive in terms of the government's response so far. And it's a tremendous advance if you compare to SARS, even though in the initial stage there was some parallel, but it has changed so much, so fundamentally. So I think that should be commended. And there's also the massive participation from everyone in China, which is very impressive. And it's a huge commitment in everyone on the ground. So I think that should be recognized rather than just say it's repeating the history. So I want to just mention that Now, in terms of what will happen and how we're going to deal with what's going to happen, unfortunately, Geonosis, which is spread over from animals, have happening quite often. In among all human history, we have over 1,000 infectious disease, and over around three-quarters of those are coming from animals. And every time, this is a very humbling experience. It just shows you once again how vulnerable as human beings we are in terms of all kinds of infections out there. And we have all these measures, but sometimes there's limits, so we have to acknowledge that, not that everything put in place you would have a perfect outcome. So we have to keep those in mind in terms of what we can do and what we cannot, and just do whatever we can do to at least slow down if there's actually a pandemic going on, that will buy us some time to develop treatment. There have been several, at least dozens of clinical trials going on, and that's at impressive speed as well. And I also heard that there's vaccine being developed, and they're going to do clinical trial by April. Again, this is very impressive, even for a pandemic flu where we have tons of experience coming from seasonal flu epidemic. It takes over 6 months to just develop a vaccine. And this is a new virus. It takes time to put in the effort and to scale up available dose for the entire population. So we have to consider this operational difficulty as well. It's not like you have the technique, then you can go whatever you can do, like in a clip, then you do it. That's not the case. It takes time, especially if you put in like in a pandemic situation for a basic reproductive number of 2, which is the number of people you can infect from one infection. That means you can the virus has the potential to infect 60% of the entire population. So that's a massive number. And to protect 60% of the population, think about the amount of vaccine dose you need to produce. It takes time. So I think that has to take into account in terms of devising the control measures. Now, in terms of whether we need to wear masks or not, for New York City, I'd say no for the time being, since we don't have case here. But I do think that a healthy level of paranoia is good. Like that means if there indeed an outbreak going on in the city, people are more willing to stay at home. So social distancing is very important in terms of reducing the transmission. So we do want people to have that kind of healthy like a paranoia in terms of I'm gonna be infected. I'll just stay at home if I can afford it. So I think that would be good. Now, in terms of racism, if I'm wearing a mask, I get attacked by maybe some people because I'm Asian. So that's one of the things we have to deal with in terms of racism, is that no one gets any good. We saw this repeatedly in HIV epidemic. If you like discriminate against people, you drive people into hiding, and you, as a result, you have more infection from that. So we have to keep our terror at bay as well in terms of dealing with epidemic at a personal level.
Okay. All right. So we have lots of hands here first.
One question I had, excellent presentation and a lot of good information. One question I had is what can people in the United States do to assist in the relief efforts in China? You know, you met Professor Huang, you mentioned that there's been an interruption in manufacturing of masks and medical supplies and so on. And are there, you know, specific organizations that you can point people to that are involved in that, and people can make contributions to?
So the question is briefly that what can we do on the side of the United States as individuals to help China in this at this time?
I think when you are facing like a major acute disease outbreak like this, right, you would expect, right, every country, right, to work together to prevent, to contain the spread of the virus. Right? And this is different from like this kind of collaboration, cooperation is different from like a cooperation. U.S. cooperate with China developing a new drug, right, to cure cancer. Because here, I think the dilemma, it's a different kind of dilemma. What was the political scientists called the dilemma of common avoidance, right? Because you want to avoid a major disaster, right? That if it happens, right, it's going to impact everybody, right? But there's developing a joint development of a new drug. That is what we call the dilemma of common interests. Right? Well, if we use that again, this is jargon of the game theory literature, right? That you have always the problem of cheating, right? And they're also concerned about distributional consequences. So it's not in the situation like this, when we're facing a major disease outbreak, you would expect all countries would choose to cooperate, because that situation is indeed what leads to a natural equilibrium. But in this case, what we saw is very odd. Right? We saw that the United States, right, trying to offer aid. Right? The U.S. pledged $100 million, right? But the Chinese government say we haven't received it, we haven't seen it, right? Although, but the non-public assistance, right, from the business sector, from the private citizens, we have indeed seen a lot of support, right, to China. But the CDC offer to help has been adamantly rejected until very recently. Right? I think that was unfortunate. I'm not blaming either China or the United States for that, but it's very clear, right, that against the background of the deteriorating U.S.-China relations, this lack of trust, these misperceptions actually have poisoned, right, the otherwise cooperation between the countries in dealing with this outbreak, which I found this is rather unfortunate.
Okay. Take another question. Yes.
I have a question for Huang. Thank you. Thank all of you for the presentation. But do you have any information yet on the seasonality of this virus? If you look at seasonal cues, the weather gets warm, it goes away. In 1918, it didn't go away when the weather got warm. What do we know about this one?
Yeah, really quick. The question is about any information on the seasonality of this particular virus.
Yeah, great question. We don't have enough information in terms of the seasonality as of yet, but in general, viral infections, they favored cold environments, and there have been some historical study based on the SARS virus, which is the close cousin of the current novel coronavirus, and they actually show some similarity between the SARS COVID versus the flu. And I study seasonality of the flu. The flu virus is actually favors the cold and dry conditions. So that's why one of the reasons we have seasonal epidemic for the flu during winter, and during the winter we have the heating, so indoor environment is very dry, so that's actually very favorable for the transmission of the flu virus. And there has been report that the SARS coronavirus share the similar characteristic. But in terms of flu transmission, we are also seeing the other spectrum. The flu tend to surge in rainy season in places like the subtropical region or tropical region, like things like Hong Kong or Uganda. And so studies have been showing that flu virus tend to survive better in extremely humid conditions as well. So there's possibility that if the coronavirus does resemble the flu or the SARS virus, and so we would expect in temporal regions you have a huge outbreak in the winter, and in the summer that will get reduced a little bit. But like I mentioned, in subtropical and tropical regions, substantial transmission could still happen if the virus like very humid condition as well.
Mhm. Yeah, I have a question right here. The lady.
Yeah.
Yeah.
My question is about the tendency not to encourage people to talk about it online, and what happened with the doctors who made an effort to warn each other. And I thought this still seems to be a fear on WeChat, like the little bit we've seen of people talking. And I thought that in fact there was internationally, there was more sense that if people talk about it, it will be helpful to learn where it is having an effect, and for people to figure it out and to mobilize the population. And I thought with SARS, people in fact gained a real ability in China to really look at things and talk about them, and that was very helpful for a period through at least 2012 or whatever. So I wondered if anybody has any thoughts about that in the season of the
Yes, so when you want to address this.
So the question is about whether we can use internet or other social media platforms to facilitate, the more useful spread of information.
Well, after the SARS outbreak, right, China built the world's largest disease surveillance network, right, that allow even the grassroots health officials, the healthcare workers to report the cases to the national CDC. And unfortunately, this network during this coronavirus outbreak, that was admitted by even the Chinese government officials, but it didn't work. And Dr. Zhang Jixian, who worked at a hospital in Wuhan, report the suspected cases to the up-level health authorities on December 26th or 28th, I think. So actually, the healthcare commission in Wuhan did get the message, and so was the did the national CDC. That is why on December 31st, right, they dispatched a team of experts to Wuhan to investigate the disease, right? But somehow, something happened, that 2 weeks essentially was squandered, that could provide a window, real opportunity to contain the outbreak, at least in Wuhan, but that didn't work out. So simply, just to answer your question, I think having those hardware, those infrastructure in place, right, won't necessarily mean you have that robust capacity in place. In fact, according to a self-study conducted by China in 2014, right, China made more than 90% of this core response, cause surveillance and response capacities is obliged by the international health regulations, that was amended in 2005. So you could imagine, right, that even you have the system in place, you have this infrastructure in place. Right? Again, it's the people, right? It's institutions that are equally, I think, important.
I have a question that sort of relates to it. You brought up about what we can do in the U.S. The concern you brought up about the friction between the United States and China is developed recently. I think that's a big factor in whether or not we're going to take control of this infection. I think we need international collaboration to address the problem. One idea I've heard recently is that there should be a summit between President Trump, Xi Jinping, and President Putin to, well, this was brought up around the issue of danger of war, but I think this is also another very important matter to be discussing and collaborating around. And President Trump has been very adamant that Xi Jinping is a good friend of his, good relationship with China is a good thing.
I wonder whether he actually means it.
Well, I mean, I think it's clear that Mike Pompeo means it when he thinks that China is the worst thing in the world. So my question is whether or not you think that this kind of summit would be useful, and if you do, what do you think we could do to encourage it to occur so that we can generate some serious collaboration?
So let me just briefly repeat the question. It's the question about the potential of international collaboration and specifically a summit between, I guess, key world powers. What's the possibilities of that coming together and how could it be helpful?
Okay. All right. Well, I think the summit, if it happens, right, between the Chinese president, President Putin, and the President Trump, that would be a great opportunity for them to work out, some plans to prevent. I don't know when is that going to happen. Is that summit or is that?
It's a proposal.
It's a proposal.
Yeah.
Okay.
President Putin announced getting the 5 UN security.
Okay, that will be a good opportunity, that for the UN Security Council, right, to step in and remember that in 2000, the UN Security Council for the first time framed the HIV/AIDS as a international security challenge through the resolution 1308. That essentially triggered this global efforts to control the HIV/AIDS, the spread, global spread of HIV/AIDS. So potentially, I think it would be a good thing. But again, right, if you look at the global spread of the disease, right, then again, disease doesn't need a passport or visa, right, to travel from one country to another, right? So they're not going to be spread to Russia, China, or the United States, right? We are talking about a global spread. So simply having 3 countries or 5 countries to map out a plan, that would not be sufficient, as long as I think all the other related countries also chip in. So that is just my.
So I think we've got time for 2 more questions. You're in the back there.
While it may be silly, I think it also adds to the fact that because other universities are because of this virus, the fact that you can't use artificially, what does it allow the future like work with like the work created only impact that impacted economic, political,
So the question is, given what's circulating on social media about conspiracy theories, what are the panelists' thoughts about them? And also, given the fact that the virus can be replicated under certain circumstances, what issues does this bring up?
Professor Wang. Okay. Well, actually, thank you for the question. Actually, just to finish the piece that exactly your question that is under review by Foreign Affairs. The bottom line is that I think it's unlikely going to be, I agree with most scientists, it's unlikely going to be a human-made virus. Lancet just published a piece on that, basically refuting that's conspiracy theory. And also, if you just look at the incentives, United States and China in terms of developing biological weapons, the incentives are just not there. Right? For the United States, in 1969, Richard Nixon decided to abandon the U.S. biological weapons program. The reason is it's very simple. Right? Because biological weapons cannot be used for effective deterrence. Right? In his words, if some country dare use biological weapons on us, we're going to nuke them. Right? So you have nuclear weapons, right? That itself is effective deterrent. Actually, it's much more reliable, than biological weapons. There was a debate a couple of years ago talking about whether biological weapons can serve as the effective strategic deterrence. I think definitely it's not as good as nuclear weapons. And for China, because of that memory of the Japanese, the Unit 731, this biological weapons unit, experimenting biological weapons in China during World War II, and also those alleged, the U.S. use of germ weapons during the Korean War, which was I think it was not true. The Chinese government, the authorities, they are very concerned about the possible use, the biological weapons, by other countries, and so they have developed this bio defense program since 1950s. That some may suspect that they might also have developed offensive biological weapons, but even if, I say this is a big if, even if they had such programs, I think with Chinese development of the nuclear weapons, and especially after they obtained the second strike capacity since 1980s, 1982, they were able to launch the sea-based ballistic missiles. So their second strike capacity is pretty much secured in the 1980s. Well, not pretty much secured. They started to obtain that second strike capacity since 1980s. So that incentive for developing biological weapons have also been significantly reduced. In fact, 2 years later, China decided to join the BWC, the Biological Weapons Convention, pledging not to use biological weapons. So again, I think this is completely conspiracy theory.
We've got time.
So I just want to add something a little bit to what Dr. Huang just said. So that's why it's so essential that we have evidence-based communication, and rumors is very disruptive. So the Chinese people have been fighting very hard on the coronavirus with the rumor is not helping anyone. It creates fears and distrust of the government and the authorities. So it's really very disruptive. So and based on all the evidence we have so far, almost the entire genome of the virus have been sequenced, and top scientists like Dr. Huang mentioned stepped out. They published an open paper lecture on Lancet saying that overwhelming evidence showing the virus is coming from white animal. So it's really just a conspiracy theory, and we are seeing similar conspiracy theory coming on in major epidemic as well. In the Ebola epidemic several years ago in West African people, local people are saying it's not real. It's really very disruptive in terms of implementing control. So I urge you to read about it and don't be part of the rumor.
All right. Unfortunately, we're actually at 1:31. So we're out of time. I wanted to thank Dr. Huang and Dr. Yang for being here today, and thank you all for coming.